In the previous two videos, we completed genus Trypanosoma and genus Leishmania. Now in this video, we will start the genus Trichomonas. And the first species that we are going to discuss is Trichomonas fetus. Host for the Trichomonas fetus is cattle, and they cause disease called as bovine trichomoniasis or bovine trichomonosis, and location for the trichomonas is genital tract, which include prepucial cavity, urethra in bulls, and vagina, cervical, uterus, and fetal contents in cow. When it comes to the morphology, they are spindle to pear shaped, and parasite has three anterior flagella which are equal length, and one posterior long flagella. Undulating membrane extends from almost full length of the body, and the parabasal body is sausage shape, and the organisms has single nucleus. It multiplies by binary fission. When it comes to the transmission, they are naturally transmitted by coitus, which means there is no involvement of any vector, and improper artificial insemination and examination with contaminated vaginal speculum leads to the transmission of the Trichomonas species. When it comes to the life cycle, there is no involvement of any vectors, therefore the life cycle is direct, that is monoxenous. Here no cyst formation will be there, and multiplication is by longitudinal binary fission. Incubation period varies about 15 days. Now let us come to the epidemiology. Bull is the permanent source of infection carrier. Cow, it is self-limiting, and normally bull to cow transmission is there, and cow transmit the disease between the bulls. Pathogens and clinical symptoms involved. In bull, the principal infection site is prepucial cavity, and there is no diagnostic lesions is there on the site. Symptoms include pain on micturition, disinclination to the serving, and mucopurulent discharge. Such signs usually disappear in 1 to 2 weeks after infection. Early infection with small red nodules in the mucosa of the prepuce, and balanitis with discharge may be noticed. No spontaneous recovery as in cow. Bulls are permanent carriers once infected. In the cow, organisms inhabited the prepucial cavity of the bull, and the transmission to the cow occurs during the coitus or natural cervix. The trichomonads reach the uterus via cervix to produce a low-grade endometritis. After infection, organisms multiply in vagina, causing vaginitis, and then it invade uterus, edema of the endometrium, and intermittent vaginal discharge may be noticed. After fetal development, the organism may invade the fetus, causing placentitis with detachment of the placenta and early death of the fetus. There is early abortion at 1 to 16 week after successful breeding is very characteristic of this infection. In case of cow, if the placenta and the fetal membranes are expelled completely, spontaneous recovery is follows, and it is most common in the cow. But in case of bulls, there is no spontaneous recovery as the case of cow, and the animal may be unestrus, and persistent uterine discharge may be noticed. And uterus is filled with a large volume of greenish white odorless material with swarm of trichomonads in it. Due to unestrus, owner may think that the animal is pregnant. When it comes to the diagnosis, it can be diagnosed based on herd immunity. There is failure of conceive even after the repeated breeding, and examination of the prepucial washings, which include a vagina, mucopurulent discharge from the uterus, and vagina, uterine discharge from aborted animal, content from the aborted fetus, stomach, apomasum, placenta, amniotic or amniotic fluids following the abortion, and it can be cultured by using the CPLM media, which is nothing but the cysteine, peptone liver extract, maltose serum, or diamonds media, and a serological test such as cervical mucus agglutination test and intradermal test that is called as trysin test, and also ELISA can be employed to treat this trichomoniasis. Ordinarily it is self-limiting in cow, hence treatment is unnecessary. Drugs such as trypan diamagine acesurate can also be used. To control, proper herd management should be there, slaughter of the infected bulls, adopt strict artificial insemination, and strict sterile vaginal examination, and examination of bulls before service, and use of communal bulls is discouraged. Freezing up salmon with glycerol appears to be toxic to trichomonas at refrigeration temperature. And when it comes to the immunity, cows are generally immune after the recovery from the disease. And generally in cow, it is an self-limiting disease. And infected non-pregnant animal may recover without treatment. This is about Trichomonas fetus. In the next video, we will discuss the another species of the genus Trichomonas is Trichomonas gallinae, which cause the disease called avian trichomonosis. After completing this, we are successfully at the end of the three genuses of the protozoa. Thank you.